short video on abdominal aortic aneurysm, which is often called as the AAA. A AAA is typically defined as an enlargement in the dorsal aorta which supplies blood to the major parts of the body and tissues. Most of the cases here are asymptomatic or incidental finding. Normally, an aneurysm can be defined as when the diameter of aorta increases by 1.5 times of its normal diameter. Here is the normal diameter of the aorta, and here is the increased diameter of the aorta. 95 of the triple A's they start below the renal arteries. This is because there is very less collagen and proteins found there. Effects. The triple A's they can rupture at any time. At any moment of time, they can rupture, and the person needs to be taken to the hospital immediately. Clots can develop, and whenever a clot is developed, it compresses other vessels. Very deep, constant pain is there in the abdomen, and back pain is also an important indicator of the triple A. Moving forward to the causes. Tobacco use is a very important factor in developing abdominal aortic aneurysm. The causes are more similar to those of any other cardiovascular disease. Hardening of arteries is also an important prognosis. Being male, even if you are a male, you have 5 times more chances to develop the AAA. Family history is also important. Even when there has been a case of the AAA in the past generations, you are likely to develop it. Moving the differences between intact AAA and ruptured AAA. Differences between intact AAA and ruptured AAA. In an intact AAA, pain is there, and often a pulsatile mass is felt in the abdomen. If a individual has ruptured AAA, he needs to be taken to the hospital immediately. Secondly, he develops hypertension, probably because the brain senses that there has been a rupture, so it creates more and more blood by pumping more of the heart. Tachycardia is seen, which is a markedly increased rate of heart. Syncope, which is often known as fainting, it can occur because the brain detects that there has been rupture in the aorta, and blood is continuously losing, and shock can also occur. So, how do we go about diagnosing this disease? It's usually a combination of physical exam and imaging. We usually feel for a pulsatile expansile mass in the abdomen, but usually this is not the way of detection or AAA, because arteries are usually deep seated structure. Secondly, ultrasound is a very good way of examining AAA. Is a way of diagnosing with the use of sound rays. CT scan or the computed tomography scan is also a mode of detecting AAA. It is more expensive than ultrasound, and MRIs can also detect the AAA. Thank you.